Welcome to Safety Standard. This channel is dedicated to improving workplace safety through practical guidance, real-world examples, and compliance insights. Thanks for watching. Let's get into today's topic.
What would you do if your coworker suddenly collapses, everyone freezes, someone pulls out a phone, someone else starts yelling, but nobody seems to know what to do? In a real workplace emergency, those first few minutes can mean the difference between a full recovery and a tragedy. Today, I'm going to show you the essential first aid skills every worker should know before professional help arrives. And make sure you stay until the end, because I'll reveal 5 common first aid mistakes that can actually make an emergency worse, and they're mistakes people make every single day. Before we begin, remember that this video provides general first aid awareness. It is not a substitute for certified first aid, CPR, or AED training. If someone is seriously injured or experiencing a medical emergency, call 911 or your local emergency services immediately. The goal of first aid is simple: keep the person alive, prevent the injury from becoming worse, and provide care until trained medical professionals arrive. Scene safety. The first rule of first aid is one that many people forget. Don't become the next victim. Your instinct may be to rush in and help, but stop for just a moment. Look around. Is there live electricity, moving machinery, fire, hazardous chemicals, traffic, or falling objects? If the scene isn't safe, don't enter it. Instead, call emergency responders and wait until the area is secure. Remember, you can't help anyone if you become injured too. Initial assessment. Once the area is safe, approach the injured worker. Tap them gently on the shoulder. Ask loudly, "Can you hear me?" Look for normal breathing. Watch for movement. Pay attention to how they respond. If they don't respond or aren't breathing normally, it's time to act immediately. Calling for help. Here's something many people get wrong. Never yell, "Somebody call 911," when everyone thinks someone else is calling. Sometimes nobody does. Instead, point directly at one person. You, in the blue shirt. Call 911 now. Giving one specific person the responsibility dramatically increases the chance that help is on the way. Bleeding control. One of the most dangerous workplace injuries is severe bleeding. A person can lose a life-threatening amount of blood in just a few minutes. If gloves are available, put them on first. Protecting yourself from blood exposure allows you to continue helping safely. Then place clean gauze or a clean cloth directly over the wound. Apply firm, continuous pressure. Here's something many people don't realize. Every time you lift the dressing to take a look, you can pull away the blood clot your body is trying to form. If blood soaks through, don't remove the first dressing. Simply place another one on top and continue applying pressure. If the bleeding still won't stop, and you've been trained to use one, a commercial tourniquet can save a life. Place it above the injury. Tighten it until the bleeding stops. Leave it in place until emergency medical professionals arrive. Properly applied tourniquets save lives every day. But bleeding isn't the only emergency you'll face on the job. Let's talk about another injury where many people accidentally make things worse. Burns. Burn injuries happen every day in construction, manufacturing, maintenance, and food service. The first few minutes matter. For most heat burns, immediately cool the area using cool running water for at least 20 minutes. Notice I said cool water, not ice. Ice can actually increase tissue damage. You've probably heard people recommend butter, toothpaste, cooking oil, or other home remedies. Don't. None of them help. Some can actually trap heat and make the injury worse. Instead, cover the burn loosely with a clean dressing. Seek medical attention if the burn is large, deep, electrical, chemical, or involves the face, hands, feet, or airway. Electrical injuries. Now let's talk about one emergency where your instinct to help immediately could actually put your own life at risk. Electrical injuries. Here's the rule. Never touch someone who is still in contact with electricity. Shut off the power first. Use the emergency disconnect if it's safe to do so. Only after you've confirmed the power is off should you approach the injured person. Remember, electrical injuries can cause serious internal damage, even when there are very few visible injuries. Choking. Choking emergencies happen faster than most people realize. Many occur during lunch breaks or while workers are eating on the job. If someone cannot speak, cannot cough, or cannot breathe, recognize the universal choking sign immediately. If you're trained, begin abdominal thrusts for a conscious adult with a completely blocked airway. Continue until the object comes out or emergency responders take over. CPR and AED. Cardiac arrest is one of the most time-critical emergencies you'll ever face. Every minute without CPR and defibrillation dramatically lowers the chance of survival. If you're trained in CPR, begin chest compressions immediately. Push hard. Push fast. Allow the chest to fully recoil between compressions. Continue until another trained rescuer takes over or emergency responders arrive. If an AED is available, send someone to get it immediately. Here's something many people don't know. Modern AEDs are designed for ordinary people, not just healthcare professionals. Simply turn it on. Follow the voice prompts. The device analyzes the person's heart rhythm and will only advise a shock if one is actually needed. Shock. Even after bleeding stops, your work isn't finished. Serious injuries can lead to shock. Watch for pale skin, cold, clammy sweat, rapid breathing, weakness, confusion, or fainting. Help the person stay warm. Keep them calm. Continue monitoring them until emergency responders arrive. Heat stress. Heat-related illness deserves special attention because it can escalate surprisingly fast. We've covered this topic in detail in another safety standard video, but here are the basics. Move the worker into shade. Loosen or remove excess clothing. Apply cool water or cooling towels. If they become confused, stop sweating, have a seizure, or lose consciousness, call emergency services immediately. Heat stroke is a medical emergency. First aid kit. Quick question. Do you know exactly where the nearest first aid kit is located where you work? If not, find out today. Not tomorrow. Not after someone gets hurt. Today. A properly stocked workplace first aid kit should include gloves, sterile gauze, bandages, antiseptic wipes, burn dressings, trauma shears, medical tape, a CPR face shield, an emergency blanket, and where appropriate, a commercial tourniquet. Knowing where these supplies are located can save valuable time. 5 biggest mistakes. Before we finish, let's review the 5 biggest mistakes people make. Number 1, panicking. Stay calm. People follow calm leadership. Number 2, waiting too long to call for help. Emergency responders can't begin driving until someone makes the call. Number 3, moving someone with a possible neck or spinal injury unless they're in immediate danger. Number 4, using outdated home remedies instead of proven first aid techniques. And number 5, assuming someone else knows what to do. Don't assume. Take action. Remember, first aid isn't about being a hero. It's about staying calm, protecting yourself, making smart decisions, and giving someone their best chance until professional medical help arrives. The confidence you build today could one day save a coworker, a friend, or someone you love. If today's video helped you, click like, subscribe to Safety Standard, and share it with someone you work with every day. And one final thought. Watching a video is a great first step, but there is no substitute for hands-on training. I encourage every one of you to take a certified first aid, CPR, and AED course through a recognized training organization. Practicing these skills with experienced instructors builds confidence that simply watching a video never can. You never know when that training could help you save a life. Thank you for watching. Stay prepared, stay safe, and I'll see you in the next safety standard video.